Skincare in your 30s can be very confusing. Are you putting enough things on? Are you putting too many things on? Are you doing everything you're supposed to be doing to prevent those wrinkles and fine lines and really have that healthy skin? Let's talk about that. I'm Dr. Brown. I'm a board certified medical and cosmetic dermatologist. I help patients every day to feel more confident in their skin. And we're not talking about just fine lines and wrinkles. We're talking about having healthy skin because really that's the goal. By the end of this video, you'll know exactly what to do for your skincare if you're in your 30s. In our 30s, we start losing elastin and collagen. Actually, we start losing those in our late 20s. Elastin is what gives your skin elasticity and keeps it in place. So as you get older, the skin gets more thin and more like an old rubber band where it starts sagging and doesn't quite return back into place. And then in our 30s, we start losing collagen. Collagen gives your skin thickness. So as your collagen decreases, the skin gets thinner. Combine that with the gravity and loss of elastin, it starts to sag. So we're going to go through some tips of what you can do as far as your products, skincare, procedures, and things like that to help slow that down, because obviously you can't stop it or go back in time. Let's start with some topical skincare products that you should be using by the time you've hit your 30s and then throughout your 30s. Number one, sunscreen. That's a must. You should wear sunscreen every single day. The best sunscreen is the one that you're going to use. So making sure that you like the way it feels, the way it goes on, so you'll use it every day is probably the most important thing. Second most important thing when picking sunscreen is that it's SPF at least 30. And then the next, if you suffer from melasma or pigmentation, I typically recommend tinted sunscreens. Tinted sunscreens have iron oxide, which further prevent those brown spots from forming due to UV radiation and LED lights. After sunscreen, second step that's most important in keeping your skin healthy and slowing down the aging process is, you guessed it, vitamin A or retinol. So retinols are vitamin A derivatives. They work by exfoliating the top layer of the skin, hence giving you that nice glow and getting rid of the really fine lines and wrinkles. And then they also work by stimulating collagen. So the longer you use the retinol, the thicker and healthier your skin will look. Product number 3 I recommend introducing in your 30s, if you haven't already done so, is vitamin C. Now, unlike vitamin A or retinol that you're applying at bedtime, vitamin C goes on in the morning. It's an antioxidant. It helps increase the potency of your sunscreen by 8 times, and it helps prevent those free radicals that are formed from UV radiation. Vitamin C should go on your skin first thing in the morning. You apply your sunscreen on top of your vitamin C. So those are your top 2 ingredients you need every single morning. Now, question I get often is, do I need a moisturizer? Here's the thing. Yes, everyone should moisturize, but most sunscreens come with moisturizer already in there. If you're on the dry side, you certainly can apply moisturizer in the morning, and I would recommend doing this in between your vitamin C and your sunscreen. The easy way to think about this is that you want your treatments to go on first. So vitamin C is your morning treatment. It's what's treating that damage that you're getting from UV radiation. Vitamin C is typically a serum, so moisturizers are thicker than serums, and they're going to penetrate right through that. And you want your sunscreen to be last because it's working by reflecting the rays and scattering them and converting them into heat and releasing them. So you want that to be the last thing that you apply so you can actually work. In your 30s is also when you should start looking at your neck and hands. Patients often come in their 50s and 60s and they talk about anti-aging of their neck and hands. And neck and hands don't respond to topical or procedural treatments nearly as well as the face does. So in your 30s, making sure that when you're doing your skincare, you're really going all the way down, applying it to your neck and décolleté, and then when you have some leftover, apply it to your hands. You will thank yourself later. And this goes to all of your topicals. Now, if you're at bedtime using tretinoin, I would be a little cautious with using that on the neck because it can really irritate that skin. And unlike the skin on your face, which has oil glands, and when it dries out, it makes more oil, the skin on your neck doesn't have that many oil glands. So when it dries out, it's going to get kind of red and rashy and irritated. So I would recommend maybe retinol in the neck 2-3 nights a week, and definitely make sure you moisturize with it so you don't get irritated. Now, the things I've talked about to this point is something that everyone should really be doing. I don't care if you're into wrinkles and fine lines and preventing things, or you just want healthy skin, that is for everyone. But if you're somebody who's worried about those early lines coming on, and how's this going to look down the road, and am I really going to look my age when I'm 50 and 60, you may want to consider starting some treatments at this time. Some of the really good options is really targeting fine lines and what really your problem is. So if you're seeing lines on the forehead, I see that very commonly in the 30s. Botox will fix that. Botox, Dysport, Daxxify, Xeomin, Jeuveau. Those are called neuromodulators. They paralyze the muscle, and yes, you have less movement, but it can be done very naturally so the lines don't get deeper. Next concern I often see in the 30s is pigmentation. And some patients, in addition to doing topical treatments, they're just developing more pigment, especially women, and things like melasma, combination of pregnancies, hormones, and sun damage. you end up with brown patches. So you can specifically pick laser treatments to help improve pigmentation, or talk to your dermatologist to add other topical treatments to treat that. 30s are a really good time to start doing these things. Now that you know all the basics of the skincare in your 30s, let me give you one more tip that will help you tremendously, and it has to do with your sunscreen. Now, we talked about sunscreen on the face, I mentioned your neck and hands, and I also mentioned tinted sunscreen, probably because I suffer from melasma. Most of my patients who come in, they suffer from melasma. I see a ton of women in their 30s, and melasma is so common, and these brown patches can be very disturbing to patients. So tinted sunscreen is amazing because not only does it help with formation of brown spots, it helps cover up a little bit of sun damage and those brown spots without having to really wear makeup. But I just told you put sunscreen on your neck. And have you ever put tinted sunscreen on your neck? Because I have. It ruins your clothing. So my tip is to usually apply white sunscreen, just plain sunscreen on your neck and chest, and end tinted sunscreen about midway on the neck. And by getting just a regular white body sunscreen for your neck and chest, not only is it going to be more affordable because those tend to be less expensive, it's also going to be easier on your clothing, saving that tinted sunscreen for your face. Now, if you loved all this and you're wondering, okay, but where do I begin? Which vitamin C or which sunscreen do I get? I've got you covered. I'm going to link below some of the products that I've used in my 30s. I recommend to my patients. Check them out and see what you think. Thanks for watching. Don't forget to follow me on Instagram and TikTok at Dr. Aleksandra Brown with a K and an S. Like this and subscribe to the channel.